My name is Bhramar Mukherjee. I'm a professor of Biostatistics at the School of Public Health at University of Michigan. I have always loved and enjoyed mathematics, but struggled to see its direct relevance to society. And I think biostatistics is a field which gives you this unique opportunity to blend your math skills with your societal existence. And I grew up in India and I moved to the United States when I was 23. So I always wanted to do some research in the Indian context, and there was this project announcement in the M3 funding opportunity that the Trehan Foundation was looking for projects to work on maternal and child health in India. In rural areas where people cannot access healthcare very easily. So routine checkups during pregnancy or child development is a very esoteric, luxurious concept in those areas. And it's very difficult to set up healthcare centers and train professionals in those areas just because of the infrastructure limitation and the burden of the population and the poverty. What we thought about doing was the routine checkups that are done during pregnancy as also during early childhood. It's not very complicated. You do not necessarily need a physician to do all those tests. So how to use grassroots level community health workers in order to get some routine data. So if somebody could collect this data and we could create a prediction algorithm which will predict who are at higher risk for certain pregnancy-related complications and developmental delays and early childhood disorders, then we minimize the contact of trained professionals. The community health workers are going to collect the data in a tablet, and we have set up an interface so that the data automatically is downloaded into a cloud server here, and we only have access to the data. And then we can run this automated prediction algorithm to predict that if there is something wrong going, and then the community health workers goes back for a second visit for only those people. Science has become so interdisciplinary that you need to really work in a good team. And I'm working with Joyjit Prapal from School of Information and Sujeta Joshi from University of Michigan School of Medicine. So these people are coming from entirely different perspectives, and Joyjit is very comfortable with the ODK implementation, the tablets, the cloud sharing of data, and then I'm very comfortable with thinking about the study design. And we all have an advantage of knowing the Indian context, and I particularly speak the language where we are doing our first pilot. I think that this has a lot of potential, and particularly this hub and spoke model is very relevant for developing countries where you do not have trained professionals in miles and miles of area. So what we can do is to actually train rural people who have connection. So I think the relationship with the community is key to this, whether women and children will feel comfortable opening up and taking their suggestion. And we had an interface which the community worker actually sees everything in Bengali, and they can just scroll down and use tabs. This has become, data collection have become so much more streamlined because you don't have those paper forms and wrong tabulation of data, and we have automatic access to the data instantaneously. That creates the context for the project, that blending what is very modern with a very underprivileged segment of the population, of the world population, and try to help them with that.